Hello, and welcome to It's All About Your Health, Straight Talk with Dr. Nancy. My name is Nancy Greer-Williams, and I am a health researcher for the University of Arkansas for Medical Sciences.
So compliance refers to going along with the care plan that has been prescribed for an individual by their doctor, by their nurse, or by their healthcare provider. And in many cases, we think of compliance as just following or just taking a particular medication. But I think we should broaden that definition to simply mean following the care plan that is developed for an individual by their healthcare provider. When you are in a doctor's appointment, we know that current trends in healthcare may limit the amount of time that we assume the physician has to spend with us, but in actuality, they like spending time with us. So if we can develop a relationship with them, you may start off with the small talk. Hey, how are your kids doing? Oh, they're doing fine. Like, build a relationship with them so that you can spend some time talking, and then go into, so what are our plans? What are the goals for this treatment and this therapy for me and my blood pressure, or me and my cholesterol, or for this sore throat? Whatever the case may be, you want to feel empowered when this decision is being made, and not just, okay, I'm going to write you a prescription and you should get better. Take time, ask questions, understand what's going on and what we're trying to prevent from happening. And then I think that those type things help people to want to be compliant to the therapies that are provided for them. In many cases, patients may experience a side effect that is undesirable, and it's a complete surprise in some instances, and that may influence them to stop taking a medication that may be vital for their long-term health. But during that time when you're getting a new prescription, you can ask those questions then. So, doctor, whatever your doctor's name is, what type of side effects are associated with this class of drug versus that class of drug? And what should I do if this happens? Will this side effect go away? And if that is, and if you're not, and you can also follow up with your pharmacist when you go to the pharmacy, when they always ask, do you have any questions? In some cases, you've waited in line a few minutes and you're just ready to go. But if you have time, please take advantage of the pharmacist. The pharmacist is there. They may be busy, but a major part of our responsibility is making sure that we relay that information to you. Side effects, issues about compliance that may help you achieve the optimal outcomes. So we're always ready to talk about things to expect and things that we've observed and things that patients have shared with us that may help you to be compliant, and that may help you get the optimal outcomes of your therapy. In that small talk part of the relationship building with the physician, you can express those concerns. Like, I'm on a fixed income. Is there a generic form of that medication or are there generic classes of drugs? Is there something on the Target $4 list, or the Walmart $4 list, or the Fred's Pharmacy $4 list that can be used instead? So it was a simple conversation that we could have that says, hey, you could save some money on that prescription by taking the one that's on the generic list and still have the same outcomes, if that, with that medication in that class. So there are some of these are some of the things that can happen on the front end. You can discuss those types of things with your physician. And you may just want all brand only drugs. Some people want brand only. You can say that as well. So in that decision-making process, you can influence that on the front end so that you're not making the decision between gas for the car and prescription medication. At least you can limit that as much as possible. The empowered patient is the best patient that anyone could have. So play an active role, help in the decision making, report any issues that you may have so that we can ultimately have the outcomes that we desire for you, and that's a long, healthy, fruitful life.
Thanks for watching. Our goal for this program is to give you good information that you can trust on health topics that you can use for you and your family to live a long, healthy life. If there is something in this message you want to know more about and you live in the state of Arkansas, take a moment to talk with one of our health experts at your local area health education center.